Hello, everyone. My name is Jocelyn Getchen-Kestenbaum, and I am Associate Clinical Professor of Law at the Benjamin N. Cardozo School of Law and Director of the Cardozo Law Institute in Holocaust and Human Rights. I welcome you to our discussion today, Supporting Mental and Public Health Prevention Work in Pre-Atrocity, Atrocity, and Post-Atrocity Settings. I'd like to take this time to acknowledge that the Benjamin N. Cardozo School of Law is situated on the Lenape island of Manhattan in Lenapehoking, the Lenape homeland. We pay respect to Lenape peoples, past, present, and future, and their continuing presence in the homeland and throughout the Lenape diaspora. I'd also like to add that this is the second of several panels we're holding as part of our digital dialogue series to showcase our new book, Public Health, Mental Health, and Mass Atrocity Prevention. And if you're interested in purchasing the book, a link is being dropped into the chat now where you can order it. And there is a discount code that will also be dropped into the chat, which is FLY21. So you can purchase the book and get it at the best rate that we are all getting that book. And I also want to mention we're having an annual Lemkin Awards ceremony tomorrow, Thursday, November 11th at 5:30 p.m. Eastern Time. And the registration link for that event is also going to be dropped in the chat now. The Cardozo Law Institute in Holocaust and Human Rights, also known as CLEAR, is a leading global center for the study, teaching, and promotion of human rights. We strengthen laws, norms, and institutions to prevent mass atrocities, protect affected populations, and to rebuild societies in the wake of atrocity crimes. As a think tank, CLEAR furthers the theory and scholarship of human rights and atrocity prevention, while the action arm of our institute, the Benjamin B. Ferencz Human Rights and Atrocity Prevention Clinic, trains law students in human rights and atrocity prevention practice. Before we begin, I have a few housekeeping items. First, this panel is being recorded and the recording will be distributed on our Twitter account, and you can follow us at Cardozo Clear. Second, this event is offering 1.5 CLE credits for those attorneys who are attending today who wish to receive New York State CLE credit for this program. To receive those credits, you must report all of the codes that we will be giving to you on our online affirmation form that is being dropped in the chat box as well right now. And it'll also be sent to each of you via email after the panel. Please note that you must attend the live recording or you won't be eligible for the CLE credit. And if you have any questions, please drop them into the question and answer box. We're going to have an interesting conversation, but we also want to, as much as possible, get all of you participants into that conversation. So drop as many questions into the chat box as you can when you have them, and during the Q&A portion, we'll get to those questions. Finally, I want to give a special thanks to our panelists for joining us today, our student fellow, Lizzie Sokla, for helping us organize this event, and the Cardozo Events Office for their support. Without further ado, I want to introduce our moderator for today's panel, and he will then introduce our speakers and begin our conversation on today's topics. Each speaker has an impressive and extensive background that will be shared in the chat. But our moderator for today is one of the co-editors of Public Health, Mental Health, and Mass Atrocity Prevention, Arlen Fuller. Arlen is an attorney and currently serves as Chief Operating Officer of Conflicts Dynamics International. Without further ado, I'm turning it over to you, Arlen, to begin our conversation.
Great, thank you, Jocelyn. Welcome, everybody. I do want to welcome everyone to today's discussion. And just as Jocelyn said, this event is the second online discussion that we're hosting as part of our digital dialogue series, showcasing our new edited volume. Our next event will be online on January 26th next year. So do keep your eye out for more sessions of this great series with academics and practitioners that are exploring the intersection of this important field of identity-based prevention, violence prevention. Just as Jocelyn said, in terms of housekeeping, there is a CLE credit for this event and a code that I'll be sharing later in the discussion. And do know that I will do it a number of times. So if in the whole flow of our talk, if you missed it the first time, there'll be other opportunities to catch that. I'll try to do that as often as I can in between the question and answers. As Jocelyn said, my name is Arlen Fuller, and I'm the Chief Operating Officer of Conflict Dynamics International. Founded in 2004, Conflict Dynamics International is an organization whose mission is to prevent and resolve violent conflict and to alleviate human suffering arising from crises around the world. CDI does not view violent conflicts as always a natural or inevitable state of things. So we work as an organization to change that narrative through shuttle negotiations, inclusive dialogues, and mediation. We also seek to prevent future conflict and violence, not only by alleviating immediate suffering, but also addressing the root causes of violence. And it's in that approach that the topics of public health and mental health and mass atrocity prevention is of great interest to me and my colleagues at CDI. Prevention is critical in peace building. And we recognize that the act of addressing the root causes of violent conflict requires a multidisciplinary approach from actors in many different fields. And I think that's what is captured so well in our book. This has been a multi-year effort with so many different practitioners and scholars. And I just want to say as well that it's an honor to be involved with such a committed group of individuals, as well, including my co-editors, Jocelyn Getchin-Ketzenbaum, Caitlin Mahoney, and Amy Mead. Before I hand it off to our two speakers, maybe I can just spend a minute or two just talking about the book itself. And I think actually it's just a little bit of a discussion on the book really will set the stage for our talk today as well. The book, as we've said, is a multidisciplinary volume that considers the role of public health and mental health policies and practices in the prevention of mass atrocity. And in terms of mass atrocity, that means war crimes, crimes against humanity, genocide, and the crime of aggression. In atrocity prevention, I think the current realities that we see really make clear that we need a better understanding of which tools and policies are necessary to enhance prevention of atrocity crimes. The legal tools, the policies, the frameworks, all of which that we currently use to suppress root causes of oppression really have proven to be limited in preventing and responding adequately. And it's to this end that I think our book really seeks to examine how the fields of public health and mental health can really offer new ways of addressing the harms, and through the prevention of risk factors that lead to violence and crimes of atrocity, that we can find better approaches towards reaching positive results. These complementary fields of public health and mental health, have robust and adaptable tools and frameworks to assess risk and prevent harms at the individual, the community, the societal levels, all of which that may prove to be a benefit to preventing mass violence. As it relates to our two speakers today, and their two chapters, the past years, 2020 and 2021, has been a divisive time that has showed the importance of their chapters themselves. Systemic and systematic discrimination and violence against minority groups are bringing the world to really a dangerous breaking point. That breaking point really has been evident to the whole world. And just last year, as Americans took to the streets to denounce the systematic police brutality and racism in the wake of the publicized murders of Black Americans, such as George Floyd or Breonna Taylor or Ahmaud Arbery or many other individuals. At the same time, the COVID pandemic has emerged as one of the greatest global disruptions in human history. And as we address the global pandemic, its disproportionate impact on minority communities has served to further magnify the health inequities that we have in access and treatment that persists in our health systems. Additionally, the stigmatization of these communities as sources of disease brings even greater reason for pause as we re-examine the root causes of inequities within our own society. Our two distinguished speakers, Magda Matake and James Densley, they both recognize the clear interplay between society and discrimination and the public health outcomes that result, whether it is in the field of gun violence and police abuse or in the stigmatization of minority groups in the COVID pandemic. They both, as Jocelyn said, they both have very impressive backgrounds, and those will be shared in the chat box. But I'm also happy to do a quick, brief little introduction of the two panelists. Dr. Magda Matake is a scholar from Romania. She is an instructor at Harvard University and is also the director of the FXB Center for Health and Human Rights Roma program at the Harvard School of Public Health. Her research and teaching focus on history and manifestations of anti-Roma racism, as well as the global history of race and racism. Magda has written extensively on the rights and agency of Roma adolescents and children as to their access to early child development, looking at segregation in education, in reparations, as well as in participatory action research. She has co-edited a number of books, including Realizing Roma Rights, which is an investigation into anti-Roma racism in Europe, as well as Time for Reparations, which is a 2021 volume exploring the issue of reparations across a broad range of historical and geographic contexts. In our book, she has written a chapter entitled Hatred Against Roma in Times of Pandemic. Dr. James Densley, he is a professor and department chair of criminal justice at Metropolitan State University, which is part of the Minnesota state system. He is also co-founder and co-president of the Violence Project, a nonpartisan nonprofit research center best known for its mass shooter database, and that is funded by the National Institute of Justice. Dr. Densley has received global media attention for his work on street gangs, criminal networks, violence and policing, and he's the author of 7 books, including The Violence Project, How to Stop a Mass Shooting Epidemic. And in our book, he has written a chapter entitled Over-Policed and Underprotected, Police as a Symptom and Cause of Urban Violence in America's Black Communities. And with that, I think I would like to open it up to our speakers. James, why don't I start with you, and then Magda, I'll let you lead off with the Q&A. James, in your chapter, you examined the structural and behavioral violence against Black individuals and communities in the United States as a continuation of past atrocity crimes, from slavery to Jim Crow persecution. Maybe you can tell us a little bit more about what you wrote, and also maybe add within the context, how applying a public health lens to your analysis added some benefit towards your findings.
Yeah, thanks, Arlen. I'm delighted to be here and be part of this work, and was really excited to contribute a chapter to this volume. And I've got to give a shout out to, and I think she's on the call, to Caitlin Mahoney, who's a colleague of mine at Metropolitan State University and was the person who convinced me that this chapter fit within this particular endeavor, because I did have major imposter syndrome throughout some of this, in so much that when I thought about the concept of atrocity crime, I wasn't entirely sure whether or not a focus on police violence in the United States and everyday gun violence in Black communities across the United States fit the traditional definition, if you will. But as we went through the workshop and explored some of these ideas more, I became more and more convinced that actually applying this kind of public health lens was really beneficial to understanding this phenomena. So as you mentioned in your question, what I tried to do in this particular chapter is to locate everyday gun violence that plagues Black people and Black communities across the United States as both a public health issue, but also as a symptom of a broader structural inequality and challenge, which is police violence. That there was a line in a book called Ghettocide, written by Jill Lovey, who was an LA Times reporter, that really was the jumping off point for the thesis of the chapter. And so she wrote, and I'll sort of quote here, African Americans has suffered from such a lack of effective criminal justice, and this more than anything is the reason for the nation's long-standing plague of Black homicides. She argues in this book that America's history of racial injustice, which is a feature of American policing from its beginning, is partly to blame for the reasons why Black people don't trust the criminal justice system, and that Black people feel forced to have to take justice into their own hands. And this includes having to effectively police themselves. And so in the chapter, I try and frame this historically, so we can look at the origins of policing itself, the way in which it emerged out of sort of two separate entities. One, slave patrols in the South, and then also in the North, the police departments, which were basically tasked with controlling the masses, if you will, because of them being poor and disorderly and not really fitting in with polite white society. So there was sort of a white supremacist origin to even the beginning of law enforcement. And as you move through history, you see that law enforcement are present at some of the worst atrocities in American history and are tasked with maintaining order, quote unquote, which usually means suppressing any sort of rebellion or uprising when people were challenging what was going on in their communities. So you see police present during the civil rights movement, but as you look at it now, they appear to be on the wrong side of history, if that makes sense. So those black and white photographs that we see of police dogs biting protesters, or of Lewis and Martin Luther King and other civil rights figures being brutalized by the police, you can sort of see how this continues. You move forward to the present day, of course, and you notice that a lot of the protests and uprisings, which are really just asking for basic human rights, often have their origins in an act of police violence. So we can see this with Rodney King, we can see this with George Floyd, and so on and so forth. And so placing this into historical context is really important because it helps frame why certain populations don't trust the police to begin with and never have done, but also why then they wouldn't call the police to try and remedy interpersonal conflict and violence within the community, and how this in turn can create cycles of violence that are retaliatory. So there's a lot there to unpack in a short chapter, to go through 300 years of US history. But I think it was really important to really lay that foundation when you think about, if we are going to solve this problem, we have to understand it structurally in historical context. And that's really what that was all about.
Great. Yeah, thank you, James. That's a really great start for our talk. Magda, I'll turn to you. And your chapter really examined the historical and present day discrimination, violence, and atrocities perpetuated against the Roma community through both the criminalization of identities, as well as the blaming of communities for the spread of disease during pandemic crises. Maybe you could tell us as well more about your chapter and how you applied a public health lens towards the aspects on the need to prevent atrocity crimes that are committed in the name of public health. And I mean, certainly, just in terms of your two chapters, this will be a great discussion on the back and forth in terms of these two very different but very, very similar contexts. But maybe, Magda, I'll let you start with the discussion on your chapter.
Thank you very much. And thank you for the invitation to participate in this event, and more so for the invitation to be part of this incredible conversation about global challenges, and to be part of the book. I co-authored the chapter included in the volume with Jennifer Leaning and Jacqueline Baba. And the whole process for us did not start as a writing project, but rather as a conversation about our concerns and fears in relation to a multitude of anti-Roma events and news that were happening, especially in March and April of 2020. And I wanted to make a break here and say that when I come in this space, looking at the history and the realities of Roma people, this was not new to me. I have a lived experience, and also as a researcher and an activist, I've seen many waves of anti-Roma racism. I've seen many overt and covert manifestations of anti-Roma racism. So it wasn't really, new, but to a large extent, I recall trying to work last year, but yet getting overwhelmed and concerned, and basically trying to understand what was going on at that particular moment. So then I spent hours and hours reading news and comments from Europe, and very often these narratives were fake and racist news. The news would involve hate crimes or hate speech, and we would see these wave of politicians, journalists, but also people blaming and labeling Roma as sources of the coronavirus contamination. So initially we started to document and to monitor those instances of hate speech or hate crime, but also we tried to identify these patterns of race or cultural prejudice that were being used to justify, to enable, to legitimize racist policy measures or fake news or violence against Roma in 2020. So it was, it was a process that started step by step, but eventually, got us to create the framework for this chapter. And I think it's important to say that working with Jennifer Leaning, who is a scholar of genocide and atrocities, it was impossible not to look at the past. So basically, we tried to take a look back and look at the history of pandemics and the ways in which Roma were portrayed and racialized and put in face of violence and anti-Roma policies throughout the history. So eventually the purpose of our chapter was really to document present day realities and to look at instances of violence and hate crimes against Roma during the COVID-19 pandemic, but then also placing this whole, reality in the broader conversation and the broader history of scapegoating people of color during epidemics or pandemics. And I want to say that it wasn't just scapegoating, but it was also how people of color were used in different political projects during various pandemics. And, we list there in the chapter various instances from the way that Jewish people were scapegoated in the 12th century to the small pox outbreak in the 19th century and the impact on Black Americans, to the Chinese Americans scapegoated in San Francisco in the early 1900s. But we also look, as I said, at these other political projects, like for instance, South Africa, and how South Africans, Black South Africans were scapegoating in this process, or the beginning, the first steps of the apartheid, or the ways in which Native Americans were killed and contaminated with smallpox by North American colonists. So what we were trying to prove, at least in the first part of our chapter, was to say that the choice of scapegoats during pandemics was typically not random, and it often builds on a history of pre-existing injustice. And it was somehow surprising, but also upsetting to see that, knowing this history, last year and more so this year as well, the world was not and has not really been doing better in preventing and stopping the scapegoating of oppressed peoples during pandemic. And this was the case, of the Roma people in 2020 and 2021. And in the chapter, we list various categories of anti-Roma racism and manifestations of anti-Roma racism, and connecting somehow the past with the present. For instance, we look at typhus epidemic in Bulgaria in the 1900s, and the policies that the local authorities put in place to deport Roma, to get rid of the Roma from their places, to actually say that Roma were those Roma who didn't get typhus, they did so because genetically they were not able to they were not getting the disease. And then we look at present day realities, and we see that in Bulgaria, again, there are so many similarities with the policies in the 1920s and 1940s regarding typhus. But then this time around, for COVID-19 pandemics, we see roadblocks, we see drones, we see militarization in other countries. We see an interest to actually keep Roma away from non-Roma, for the white Europeans in these processes. And then it's not just the state institutions, which in many countries, and I could list, many of these policy measures which were awfully racist. There were also reactions from journalists, war from people. And in many instances, for instance, journalists and also the social media would spread a lot of fake news, a lot of messages that would put Roma at risk. And there is this instance, for instance, from Spain, where a local Spanish citizen spread an audio message saying that all the Roma in that neighborhood should have been incarcerated, and that they said that this message came from the mayor, and then later, of course, we found out that it wasn't the mayor. There was also, and there has been a lot of violence also from different people, and we see, for instance, again in Spain, a vigilante citizen who murdered a Roma man before the eyes of his 7-year-old son, or we see in Kiev in Ukraine instances when extremist groups were violent towards Roma, or people would just attack Roma families and so on. So what I'm saying, and perhaps to conclude here, is that anti-Roma racism has been there for centuries, since the arrival on Roma on the territories of Europe. But in times of pandemic, and more so in during the COVID-19 pandemic, we have witnessed this increase, and if you want, exacerbation of violence and very blunt expressions of anti-Roma racism through, hate speech, hate crimes, and anti-Roma policies.
Yeah, thank you, Magda. No, I really appreciate the clarity on the chapter, and I think that the two of you, from what you've written, really sort of show a very strong grounding in the history of racism and discrimination in both situations, and I do want to get back to that and have that as one of our questions, just simply because the understanding of history and the teaching of history in terms of where all societies have been in terms of race relations and discrimination is something that obviously seems to be repeated even up to today as we're talking about the COVID pandemic. But first, in terms of one of the other questions I had for you, Magda, is what reflections do you also have as it relates to the Roma community, as it relates to what James has been commenting on in terms of policing and urban violence? How does his examination of the challenges of urban policing, the self-policing that communities have to do when there's a level of distrust in the institutions, how does that relate to the Roma community in Europe?
Oh, thank you for that question. I think that it goes without saying, but I want to reiterate this, that each oppression and each racism has specificities and particularities, including in terms of history, but also manifestations of that particular form of racism. But yet oftentimes we see that oppressions find similarities in means. And I think that in particular cases, when Europeans are the ones who colonized outside borders, but also within borders, thinking about Roma, some of these manifestations or means or tools to oppress have found similarities. And I think that one issue that James talked about in his chapter was the absence, as he called it, of fair and impartial policing and formal justice for Black Americans, as well as discriminatory patterns of policing, right? So I think that if we are to look back at our chapter, but also at the developments that we've seen in the past few decades in Europe, one thing that I would say is that we do find a similarity in the ways in which Roma experience hatred and police violence in Europe. And I'll give you just one example from this year, when in June, Stanislav Tomasz, who was a 46-year-old Roma man from the Czech Republic, was killed by a police officer. Basically, the police officer kneeled on Tomasz's neck for 6 minutes. And in response to the killing, the Minister of Interior basically in Czech Republic praised the police officers for the so-called good work. And this was a case that made, made some waves in the Roma movement. There were some protests organized in Europe, but it didn't move much the European leadership, and I'm talking here about European institutions or national institutions in that regard. So, and it wasn't the only case. And we see, for instance, in April in Slovakia, another case when a police officer beat one Roma boy and 4 Romani girls with a truncheon and also threatened to shoot them. These are kids, like young, very young kids. And I could give you many examples from many countries, but I do, perhaps just to give you numbers in terms instead of examples. I remember this article from the New York Times from July last year, where they argued that since the beginning of the pandemic, there had been 15 incidents of police violence against Roma people. Only in the countries where they started to document a little bit the situation, and these countries were Romania, Serbia, Slovakia, the Netherlands, and North Macedonia. But similar to the case of the United States, and perhaps even worse, we don't really have an actual account, an accurate account of these killings. And I think that James does a great job in explaining that process in his chapter. But we also see, for instance, in Romania, the country where I come from, that from March to May 2020, Romani Cris, the organization that I used to work with, documented also 6 cases of police violence with about 20 Roma victims, including 3 children. And from 2006 to 2015 at Romani Cris, we documented 48 cases of police brutality. And that meant 7 Romani people killed and 187 beaten or tortured. And here again, we are talking about a small organization with a limited amount of funding and resources, so we could not actually document all the cases that happened in the country. And I do want to underline, and perhaps getting back a little bit to James' point, that in all the cases that my organization brought before the court in Romania, the Romanian prosecutors and the courts rejected the complaints filed by the Roma victims. But all the cases that we succeeded to bring before the European Court of Human Rights condemned the state and for the violation of human rights and gave justice to Romani people. So what I'm saying is that if we ought to look more broadly at the criminal justice system, we have to underline that there is racism, that there is prejudice, there is bias in the way in which Roma are treated. And I'll conclude here by saying that a 2021 study that looked at Romania, Spain, Hungary, and Bulgaria showed that anti-Roma racism impacts the whole criminal justice system, and is not just about the police, but is also about judges and prosecutors, and more so about defense lawyers, who are supposed to be the ones defending Roma. So I think that, that may give you an idea about how bad the situation is and how difficult it is for Roma people, on one hand, to trust the police, on the other hand, to trust that the criminal justice system would give them justice in cases of overt violence, very often by the police.
Oh, great. Thank you, Magda, so much. James, maybe I can also ask you a similar sort of flipping of the coin question, much as the ways Magda's demonstrated how similar and related these contexts are. Given that we are in the era of COVID, how has the pandemic, or how does the pandemic pertain to your chapter, the Black community more generally, as well as the police community, which obviously, as the COVID pandemic has been so politicized, and that the same level of politicization of the policing, as well as the sort of conservative nature that the police community has a reputation of here in the United States. What are your thoughts as it relates to this COVID context?
Yeah, that's a great question. And yeah, because Magda's chapter does a really good job of contextualizing the discrimination and racism within COVID-19 as sort of like, this is yet another context that is used as justification for the type of treatment that we see, and the stigmatization and racialization, I think, of the Roma people. So yeah, so how has COVID impacted the issues discussed in this chapter? A lot is really the bottom line, I would say. Let me give you a couple of examples. So the chapter speaks a lot about violence. Last year, the US experienced its largest ever recorded increase in murders. So the national murder rate rose nearly 30% in 2020, and that's the biggest jump in 6 decades. At least 77% of those murders, according to government data, were committed with firearms. So what that translates into is nearly 22,000 murders in the United States. That's 5,000 more than the year before, pre-pandemic. Half of those new victims were Black. So we're talking about a significant rise in violence that is disproportionately affecting the Black population. Now, how does that relate to the pandemic? Well, multiple factors may have played a role in that murder increase. And I would think the emotional trauma, the economic instability of the pandemic, which falls hardest on the communities that are already struggling. And they disproportionately are communities of color because of the structural inequalities and structural racism that is going to put people in the positions that they're in to begin with. So I think that's really heavily related. Secondly, the pandemic dialed up fear more than anything. How people have tried to address some of that fear is by buying guns. So we saw record gun sales last year and a massive increase in gun carrying in public. Now, without getting into the whole Second Amendment debate, which could derail us dramatically, I would just say this: more guns equals more gun violence. And so that is another contributing factor, that it is definitely tied to the pandemic. Then on the policing side of the equation, the pandemic disrupted the sort of tools and tactics of the police to be able to intervene in violence. So it's hard to be socially distant and still be present in communities. More so as well, the politicization of the pandemic also resulted in sort of bizarre situations where you saw, for example, like the New York Police Department protesting against vaccine mandates, and turning this into sort of a very highly politicized issue. Now, bundled all together, what you've seen is a sort of element of depolicing, which is both a spin-off of George Floyd and the context around the police right now, the defund the police, abolish the police kind of movement. But also the pandemic is part of that. There's a lot less proactive policing in communities. Police are responding to crimes, but they're not necessarily doing a great job in preventing them, because the pandemic has disrupted some of the sort of the tools that they had to do that. So you bundle all that together and you see the rising violence, the increasing tensions. And let's not also forget as well that the pandemic, from a health standpoint, and I'm not an expert in that area and I don't profess to be, but just by a casual read of the New York Times, you know that the pandemic disproportionately affected communities of color. We saw higher rates of death, higher rates of disease, a lot of hesitancy around vaccines, not because of a sort of conspiracy theory, sort of a rebuke of science, but more just a genuine lack of faith in our institutions. And this was an extension of, Tuskegee and other examples of where we have failed communities of color in the past in terms of getting them healthcare and support. So you bundle all that together, and the pandemic has had a massive impact on this. It was interesting writing this chapter, if I'm honest. I felt like it was a moving target the whole time, because I'm writing this. We started the work on this pre-George Floyd, pre-pandemic, pre all the big debates we're having right now around abolish or defund the police and everything else. Then I'm writing the chapter about those things, and then they're happening in real time, which was just, incredible to be sort of immersed in that world at that same time. I'll also just say one last thing. Magda mentioned a data problem about we just don't know the numbers. Now, I wrote about this in the chapter using the best information I had available at the time. And I sort of speculated that we're probably looking at an undercount of about half when it came to police-involved shootings of people. Well, there was actually just a paper published a few weeks ago in The Lancet, a British medical journal, which did the full empirical analysis. And I'm going to say my guess was pretty accurate. They figured out that 17,000 officer-involved killings had been undercounted in federal data. 17,000 deaths, not in the federal databases. And this amounted to about a 60% of Black deaths in police custody being undercounted, which is just astonishing that that's the world that we live in here in the 21st century, that we can't even count how many times the police kill people. So it's reliant now on nonprofit organizations and journalists to do that tallying for us, because the government doesn't have a central database to track these types of things. Like I say, I write about that in the chapter, but it's only got worse, I think, in the interim pandemic period. So there's a lot there. Yeah.
No, thank you. James, I think that's really sort of hits upon a number of things that even as Magda was saying, and I reflected on it earlier before this last set of questions, is both of you have brought up the aspects on a very deep history and origins within slavery and the slave trade, and how these have created discriminatory foundations in which things work. And Magda, you were saying that almost as you go pandemic from pandemic, with the same repetition of these different levels of discrimination, and as if almost there's no learning from history. And also here in the United States, we have these challenges now in terms of, not to get into the depths of critical race theory and the misunderstandings of that term and the use of the way it's taught within our public school systems, but a sort of difficulty and a politicization in which we teach history, to be able to reflect back on these challenging and discriminatory and policies that really sort of have these groundings in atrocity crimes. So could maybe Magda, I'll ask you first, what is your reflection on the way in which a long history in slavery and discrimination, how has that really sort of led to the current challenges that we're seeing today? And just as I say, how could you also speak to maybe some, the policies that are currently in place, how they've been shaped and changed, and what efforts, what changes have been put in place to be able to even improve upon where things stand? So
that's a question for a PhD paper thesis, but I'll try to answer. One thing that I would like to say, perhaps because you said the phrase critical race theory, and we all have thoughts about it. I think one issue that I would underline is that we don't have a misunderstanding around what critical race theory is. It's just a rejection from many politicians and from many people against actually teaching the history of Black Americans in the United States. And I think the way that is framed is not, again, new, because very often marginalized groups and people of color have been framed and their issues have been framed in certain ways to actually be able to further marginalize, to further cancel history, and to further talk mostly about white history and white issues, and the race-neutral policies, which very often are just policies that are developed and designed for and by white men in power. That being said, I think that looking back at the history of the Roma and the relation, perhaps to this idea of gypsy criminality, if you want, one thing that I would say is that for those of you who don't know much about the history of Roma people, the migration of Roma from India to Europe has led to this global diaspora of Roma people who live in various countries, and more so in Central and Eastern Europe, but also across Europe, and nowadays also in the Americas, Australia, or the Middle East. But if we were to look at the early history of Roma people in Europe, we can see various patterns. And because Roma lived on different territories, the policies were different. One policy, which lasted for 500 years, was enslavement in the territories of nowadays Romania. And that meant that Roma were sold, they became property, they were used by enslavers, whom in Romania were the nobles, the state, but also the establishment, but also the Orthodox Church. I'm doing a lot of research now looking at enslavement in Romania, because my ancestors were enslaved people, and I'm trying to understand the history of my local community. And much of that, archival documentation that I have, it's about all these police documents or documents that would show that during these, hundreds of years, some of the issues that were brought, in conversations with local authorities were basically Roma people who ran away from the enslavers, and then the enslavers and the police authorities would look for them. And much of this idea of gypsy criminality in Romania is rooted in this, in this practice in which Roma resisted or ran away from enslavement, and Romanian enslavers felt that that was illegal, that they had a behavior that it wasn't according to the law, which it was not. But, just thinking about when a law or a policy, it's fair and just, it's also important, including in that context. And the idea of Roma criminality, especially in the context of Romania, is related to that. One example is the fact that, for instance, in the 1600s, a village in Romania is called Țigănească, which Țigan is the racial slur in Romanian for gypsy. It's called that because the peasants in that village ran away from their, from the nobles in the same way that Roma ran away. So they were being called gypsies because they behaved like Roma in this criminal way, which was basically saying no to oppression. So what I'm saying is that there is this background in Romania, but we also see other patterns in other countries. You see all these gypsy hunts organized in various countries in the north or west of Europe. And very often there is a political project or an interest related to those instances in which Roma were portrayed as criminals, but at the same time there was an interest for someone. Sometimes there was an interest for the church, because, for instance, in some countries where Roma would do fortune telling, then the church would feel that the church leadership would feel that they were actually taking from the power of the church. So there is a lot to unpack in the way in which Roma people have been portrayed throughout the centuries, but it's also important to look at history books. And for instance, I'm reading now books from the 1800s, 1700s, and we see how historians actually took for granted the idea of Roma criminality as an inborn feature of the Roma. And present day authors and historians would also just take for granted the idea that Roma were actually criminals. And this idea, it's not, it is old, but it's also new, because this is what politicians and many scholars will say today as well. So what I'm saying is that having this mythcraft, or what Barbara and Karen Fields called racecraft, about Roma as criminals, really served as a justification for many of the instances of anti-Roma racism, being them at the policy level from institutions, or being them implemented by other stakeholders, including our societies. So yes, there is a connection between the past and the present day realities of the Roma, and part of it has to, can be healed through reparations. And in the book that we published this year, we talk about tools and methods of reparations to repair the harm, but also to find ways to heal and move forward in terms of new paths in understanding Roma and treating Roma as actual people, as citizens, as opposed to criminals and others negative portrayals.
Oh, thank you, Magda. No, and as you really sort of lay out those concepts of perception of the community, James, it speaks a lot towards what I read in your chapter in terms of perception, in terms of victims of crime and perpetrators of crime. I'd love to ask you that next. I do know, Magda, unfortunately, due to a totally unavoidable conflict, we're going to lose you in a few minutes. I do want to maybe ask you one more question, if I can. Also, knowing where we are in time, I do want to just at least announce at this point, this is the first time in which I'm letting everybody know about the CLE credit code. It is, get ready, it is the word prevent with a capital P, I'm told, 93 capital K. So prevent with a capital P, 93 capital K. But Magda, I think maybe with a good way to close with you, and then James, there's a handful of things that I'd love to follow up with as well, at least as Magda's been hitting on a number of things. Magda, what could you say in terms of where we stand now? You wrote that chapter several months ago. And what have you seen in terms of policies that were put in place that have been sensitive towards Roma and towards different minorities? And an add-on one that I would have loved to have asked you if we had more time, and maybe you just can feather it in with your responses. What do you really feel in terms of the Roma community's lack of faith in institutions? And how does that actually maybe, in a sense, when we're talking about the implementation of new policies that are sensitive towards race and community, how does the challenge of faith in institutions play in?
Okay, I'll try to answer briefly to both of your questions, and perhaps in terms of policies and things that have been done, some of the policies that are put in place or proposed are actually detrimental to Roma, and they are targeting Roma, Gypsies, and travelers, for instance, or Sintis and other groups across Europe. One of the people in the chat mentioned the police bill in the UK, which indeed targets travelers, Gypsies, and Roma people in the UK, and criminalizing more so some of the patterns and some of the realities and the culture of these groups. So on one hand, we are facing an increase of policing, an increase of criminalization, and a window of opportunity to actually put on the table more racist measures and policies against Roma at the local and national level. But at the same time, I think there are some efforts which are I think just a small piece in this big puzzle of anti-Romani racism or anti-Roma and Gypsy and traveler racism. If we are to talk about the UK, there are some policies, like for instance in Spain, where a Romani member of the Spanish Parliament and other colleagues, they were trying to establish this universal basic income, which is actually a minimum wage in Spain, which eventually would support Romani communities as well. But I think that it is important to think about the resilience plan, for instance, at the European level, and to have this critique that we very rarely include Roma and the needs of Roma in these national policies, but at the same time, politicians and policymakers target Roma for policies that are negative towards the community. Now, this whole idea of the lack of faith of Roma in the institutions, it's, you know, it's hard to have faith in institutions and in people who most often would use violence and hate speech and hate crimes against you. It's hard to have faith in institutions who target, you know, a whole population for various policies that would be detrimental to their children, to their families. If we are to think, Ireland, for instance, about the policies of segregation, school segregation, which the two of us worked on this years ago, looking at the school segregation in several countries in Europe, it's hard to trust a school where your children are placed in a special school, where children are placed in a separated classroom or school building. So what I'm saying is that this process has to be both ways, and very often, you know, you see in the Roma communities, some of the traditional Roma communities, that we have this, you know, court, which is, you know, this informal court that is called Romano Cris, and is basically a wiser senior person who is dealing with the issues that some of these communities have, as opposed to going actually and dealing with the police. So there are ways and tools that Roma have, you know, historically used to stay away from these spaces. But at the same time, I do want to underline that Roma keep going and to various institutions, including hospitals and medical doctors and all that for support, and they continue to show hope and respect, but yet they don't get that back. So in thinking about racism, being it in Romania or Europe or the United States, I think that what we have to do is really to move away from this idea of integrating people, which is, you know, like colonial, like integrated, including, but actually thinking about how we become anti-racist and how we create these spaces that are welcoming, that are, you know, open to people regardless of who they are and what their history is. And with that, I'll stop here, and thank you so much for the invitation, and congratulations for the book. And I'm sorry to have to leave, but I'm happy to stay in touch with some of the people in this conversation and to answer some questions later on in the day or in the future.
That's great, Magda. Thank you so much. And thank you for joining us today and for that really amazing chapter. So for everybody, please take a look at it is chapter 5. Where Magda has her work there. So thank you so much, Magda. And James, maybe at this point I can direct a few comments to you, and many in the similar vein of what we were just asking Magda to just maximize her time before she left. Maybe what you could start at, I think about 2 questions back that I posed to Magda was really from your chapter and Magda's. It was really grounded very obviously within the origins of slavery and the slave trade. And how do you see that very deep and long history of discrimination and racism that we are seeing reflected in the challenges that we have today in both policing and with community relations? And how have those policies been shaped by our history? And maybe I'll give it to you at that point.
I mean, it's obvious that the policies have always been shaped by our history. I think Magda spoke very clearly about the way in which we tend to racialize and also criminalize certain populations. And this has played out over time, but it's also something that has been sort of historically enshrined in law as much as it has been in practice as well. And if you think of police officers as those on the front lines enforcing those laws, even if the laws themselves are not intended to be racist, sometimes they are racist in their outcomes. So an example of that might be in the disparate sentencing laws we had around crack cocaine and powder cocaine, for instance, where we knew that crack cocaine was a drug that was more prevalent in the Black community, whereas powder cocaine was more prevalent in the white community. But you still had a sentencing disparity that disproportionately affected Black people. Now, I think when they wrote those laws, I don't know if people were sitting around thinking like, aha, this is the way we can discriminate further. But in their implementation, there's absolutely no doubt that that then fed into mass incarceration, and it fed into racialized outcomes, is an example. But then, of course, you just have outright racist laws and policies that it's not by accident create racist outcomes. And I think this is the thing that's astonishing to me at the moment in the debate that we're having around how to teach history, which is, you know, Jim Crow and separate but equal, and the way in which we created an American apartheid is still lived memory for a large number of American people. You know, the civil rights movement was the 1960s. You know, that means that people's parents and grandparents were alive while that was still the case, right? Which also meant that they grew up with grandparents who were also at that time of slavery, right? So we're only 2 generations removed from this, and yet there is this sort of movement to sort of say, well, that's in the past, get over it. And we're like, well, let's put that in context a little bit here. We're talking about lived memory and lived experience. And then, of course, attached to that is the trauma and the mental health implications of that history on an entire population of people. That's aside from the economic impact of redlining in our communities and segregation in our communities and school segregation and so on and so forth. So you have the kind of sociological and economic impact of the policies that we've had, which have created the outcomes that we see today. But you also have the psychological, and with trauma, even the physical impact that this has had on our entire population of people. And so to just kind of like sweep that under the rug and say, let's move on and get over it, I think is just, it's so disingenuous, but also it makes my blood boil, because it's sort of like you have to appreciate that history to understand how we move forward and really do something about it. So yeah, I think history is a heavy weight, I think, in this entire conversation, and we ignore it at our peril, I think, is really the key takeaway there.
No, I mean, you're absolutely correct. And I think, I mean, just in the way in which you've cast this as how in US policy the history and the level of discrimination is just so pervasive. It not in any sort of very upfront way, and in almost in just the most recent of news, when we're talking about the infrastructure bill, and how they're looking at the infrastructure bill in the level of racism involved in the determination on where highways are placed. Yes. And how those highways actually then separate communities, and how the current administration in the application of the new funds that are available with the infrastructure bill, how they might be able to address and mitigate some of those past histories of the ways in which infrastructure in the most subtle of ways really still separated communities from each other. It really is quite an interesting aspect on this, and obviously ways in which then that gets misconstrued by people who choose to say that we have racist roads and things that sort of misunderstand and sort of miscategorize the ways in which interested parties who want to have these constructive conversations really are sort of interfered with by spoilers who want to sort of confuse the issues. I do also hear, as you're saying, that much in the way in which the infrastructure bill may be trying to address or right past wrongs. What other things are you seeing in your chapter? You are forward looking in the ways in which different new policies can be put in place to overcome structures that do perpetuate violence against the minority community. Maybe you could sort of give some of your thoughts as to what is the way forward here in something that is so grounded in centuries of dispute and disagreement. Where does a country like the United States move forward?
I wrote in the chapter around the debate we were having at the time I was writing it was around the need to defund the police so that we could reallocate the money that was going to law enforcement to fund more community-based alternatives to policing. And particularly in the area of sort of mental health provision, because at the moment in our current policing system, law enforcement are the only agency that can't say no. And I mean that quite sincerely. Like, this is not to necessarily give law enforcement a pass and say what they're doing is great, because they make way too many mistakes. But this is to say that if you call 911, the police will come, right? They won't necessarily respond in the way you want them to, and that's the big crux of the debate, right? But at least they will come. Now, if you are suffering from a mental health crisis and you call any other number, they will say, well, I'm sorry, the doctor's not in right now. And sorry, we don't accept your insurance. Or do you even have insurance? Or is it affordable? Or is it accessible? Or well, you're going to have to drive, across the entire country to get to the nearest provider. So this is the problem that we have with the alternatives right now, is that they don't exist. And so one of the things in the chapter I talk about is we don't have to defund our police to fund these things. We have defunded our communities for generations. And so we need to start reinvesting in our communities and building all those viable alternatives. We need a viable, sustainable mental health service. We need affordable healthcare, ideally universal healthcare that people can access it. We need infrastructure. You spoke about that infrastructure bill in the communities that have been historically neglected, isolated, alienated from the corridors of power. So all those pieces are a part of the solution here. Now, at the same time, we also need viable alternatives to police, not just on those calls that don't necessarily need a police response, but also on the calls that maybe do. So for instance, you look at even homicide, right? Of all the things I could talk about here, that's the one thing you would say, well, you definitely need a police response if there's a murder. But the reality is that the police clear, and that doesn't mean solve, that just means they arrested somebody. They might have arrested the wrong person, but it just means cleared, according to statistics, about half of homicides in this country. Now, think about that. That means if somebody is murdered in your community, it's a coin toss on whether somebody is brought to justice. This is meant to be the United States. It's meant to be the pillar of democracy. And yet we solve less than half of murders in this country. Now, what's the challenge there? Well, law enforcement will tell you it's because the community doesn't cooperate with the police. So we have to build trust to make sure that those two sides of the equation are working together. Now, that's hard when you've got that lack of faith in institutions and the history that we've talked about, but it's not impossible, because police and community can agree on one thing, which is nobody wants violence in their communities. Nobody. Nobody wants to feel unsafe. Nobody wants to be worrying about whether their son or daughter or their loved one can walk to school safely. So this is the common ground that we need to be absolutely working from. Violence is the common ground that we have to be working from. The second thing as well is there are community-based alternatives that can help design out crime and violence. So there's things that we've done to our communities to, just make it harder to perpetrate violence in a community that can be very effective. At the same time, there are also community-based and led organizations that are doing really heroic work on the streets, intervening with violence before it ever escalates and boils up to the point of a murder. So doing that preventative work on the front end. And I'll just say one good example of this. Within a given community, you talk even about Black communities, quote unquote. That's a misnomer in many ways. There's no such thing as an entire community where violence is endemic, really. What we're really talking about is not hot spots, but hot people. Within a community, there's a network of 5, 6, 7, 8 guys that are responsible, and it's usually guys, it's usually men, that are responsible for 80% of the shootings in that crime. So we have got to target those individuals, not necessarily for law enforcement intervention, but with alternatives. The people who are shooting are young people. We got to invest in our youth. We got to target the most prolific offenders. We've got to give them viable alternatives to pull them out of a life of crime and violence, whether that's street gangs or whatever it is that they're embedded in, that's giving the back and forth reciprocal homicides in these communities. Because that's what happens. If I shoot you, you and your boys come and shoot me back, and we just end up in this endless cycle of retaliatory violence. You've got to break that cycle. Part of that work is a law enforcement piece, but there's a big community component to that. And there's a big investment in our young people that is also part of that as well. So these are just some examples of those solutions. And as I said, you don't need to pull the money out of the police budget to achieve this. We just need to invest in our communities and invest in our young people and build up that infrastructure so the alternatives really are out there.
Bill, excuse me, that's great, James. And actually, you're setting up our next session in January 26th as you're talking about those exact issues. So that is really fantastic. But it also shows just how all of the chapters in our book really are just so interlinked in the ways in which a very multidisciplinary approach is required in order to have some level of to make progress and to be able to have a preventative approach towards atrocity crimes. It takes a very complex approach where everything is interlinked and interreliant. And actually, as we were talking about much in terms of as you were saying about calling 911 and the reliance on police, as well as whether or not an ambulance will come to receive you if you need care. If Magda were here as well, just my experience in working with her on past projects, that is a similar thing, that the ways in which highways have also divided up the Roma camps and Roma neighborhoods from the rest of the non-Roma population is really also evident in the things that we see in Eastern Europe and throughout the continent. The one thing I would like to tell everybody again, just a second repeat of the CLE code. Again, it is just for everyone who still requires that and this is the first time. It is the word prevent with a capital P, 93 capital K. So prevent 93K with a capital P and a capital K. So hopefully that is something that everyone who still requires that code can put that into the forms so that you can get proper credit for the for our session. James, I know we have just a few minutes left, and I would love to sort of give you any sort of final closing thoughts on the discussions that we've had and the ways in which maybe there were certain topics that didn't get enough attention as maybe you've been listening and thinking about things as we've had our back and forth. Before I give you that, could I ask you one last question that really is more also within the current events, and get your insight on the most recent vote that occurred within Minneapolis on the, quote unquote, the defunding the police measure that was voted down. It would be really interesting to know for all of us who are not living in the Minnesota area that may be as attuned to the details and nuances of that situation, but would love to get your insights, certainly as it relates to the work that you do and where you've seen things as it relates to that. And then obviously the floor is yours for any sort of final comments as well.
Yes, happy to some reflections on that bill. So for those not familiar, we just had a vote here in Minneapolis. It was broadly characterized as the defund the police bill, because it really was born in the aftermath of the murder of George Floyd and the debate around, to be honest, the lack of faith, the lack of legitimacy for the Minneapolis Police Department. The Minneapolis Police Department is broken in so many ways that we could have a forum for another 90 minutes and not even scratch the surface. And it really is one of those agencies that is in need of dramatic overhaul and reform. But here's the thing, the bill was a little bit mischaracterized. And it didn't help in terms of the way it was marketed to the people either, because in turn, it sort of created a lot of fear and anxiety about what the outcome was going to be. But here's the reality. Minneapolis has a city charter, and the city charter has a requirement in it that Minneapolis maintain a minimum number of police officers based on population size. There's a ratio there. What would have done is this bill, had it have passed, would have eliminated that requirement, which meant you wouldn't need that same number of police officers anymore. This would have then been a gateway to basically tearing down the Minneapolis Police Department and rebranding it as a Department of Public Safety. What it would have then done is it would have moved the power for policing away from the mayor and into the city council. And it would have meant that in addition to having a Department of Public Safety with police officers in it, it would also have, community workers, mental health specialists, and others that would be under that thing. Now, the bill didn't pass. The end vote ended up being about 56% to 44%. So it would be false to say that it was a complete abject failure, because it wasn't. I mean, like half the population pretty much still supported the idea. But here's the reality. The messaging was totally off on this thing, which is to say that nobody could articulate what the alternative was really going to look like. And I actually think that if they'd been able to articulate it more clearly, it would have got the support it needed. So what I mean by that is, okay, we're going to have a Department of Public Safety. How many police officers will be in it? Nobody could answer that question. Okay, we're going to have a Department of Public Safety. How many mental health workers are you going to hire? No answer. And so on and so forth. So there wasn't really a clear plan of what the alternative was going to look like. If that plan was in place, I actually think people would have voted for it, because Minneapolis PD is a mess and people were crying out for change. But the challenge that was happening at the same time is this. We already defunded the Minneapolis Police Department. And what I mean by that is there are 300 less officers today at MPD than there were pre-George Floyd. That's because 300 police officers from the Minneapolis PD, by the way, at full strength, they're 850, right? So it's 300 out of 850 have left. That's a lot of people have left because of medical leaves, retirements, stress. People have just quit. they have 300 officers less. The reason I said that we've already defunded MPD is because the vast majority of police budgets go to salaries, overtime, and personnel costs. So to some degree, there was a sort of issue here of to what extent was that lack of police presence then responsible for rising violence in Minneapolis? Because violence has doubled in the last year. I think it's correlation, not causation. But they certainly did a nice job of kind of pitting those two things against each other. What you also saw, it was in the communities where violence was greatest, which also tended to have, these are the precincts that had a majority of Black residents. That's where the bill failed to get enough support. And I think it's because that rising violence was telling them that no one was there to protect them, and that they actually genuinely wanted the police, but they wanted better police. And that's really the key implication for all of this, which is, and it speaks to my chapter almost directly, which is this idea of in the communities where violence is worse, it's not that they don't want the police, they do, but they want better police, more just police, more equitable, fair police that focus on justice for the citizens in those communities, as opposed to the types of policing they currently get, which are oppressive, derogatory, and really make you feel like you're not getting the type of support that you truly need. So now the future, what does it hold? Well, because of that charter amendment that's not been scratched off, Minneapolis has to hire 200 officers in the next year to just be in compliance because of all those officers that have left. So now there's going to be a recruiting drive into an organization that really is, it has like the worst reputation imaginable, and you're going to have to try and bring in 200 new employees. So there's a big question mark about what that's going to look like and how that's going to work. And then, of course, there's just the bigger question of what are we going to do to ensure the status quo doesn't prevail? How do you reform MPD? And how do you get that equitable and just policing injected into that agency in a way, because we can't do it through the mechanism of the bill, the amendments that failed. So it's a really fascinating time to be on the front lines here in the Twin Cities and seeing what's going on. But there's huge implications for what that future holds.
Oh, thank you so much, James. And actually, I think that is a great way, just as you were sort of ending on the forward-looking there for Minneapolis, as you're saying, at the forefront of all of this. I think that is a great way for us to end. And so I really appreciate your time and Magda's time as we've had just what seems to be a really fruitful discussion with a lot of different insights that really, I hope, for anyone who has not read your chapter or Magda's, will really be a level of incentive to go and read that in greater detail. So sincerely, I appreciate that. And Jocelyn, I know that you also do want to have any sort of things to tie things up. So please, it's all over to you to close things up.
Thanks, Arlen. I just want to say thank you so much to Magda, to James, to you for such an interesting, amazing conversation at these intersections. It really, really is so incredible to see not only this book come to life, but then through discussions with the authors to really see how important and integral this work is in the prevention of mass atrocity crimes. And if you were maybe unsure, James, how your work relates to the prevention of mass atrocity harms, I think now we've definitely sold you in that regard. So thank you so much for coming along on this project and making it a reality. And I just want to say that we are going to continue this digital dialogue series, and the next digital dialogue conversation we'll be having will be on Wednesday, January 26th at noon, and it is called Group Identity, Victim Impact, and Community Relationships in Atrocity Crimes. And so it will be the next, building on this session, the next iteration of this conversation. So I really appreciate you all being here. Thank you so much. And our video recording will be posted on our YouTube page very momentarily. So thank you all for joining and have a great day.